I always thought that this is what I meant to be. This is where I meant to be. But the interest in pediatrics is because I love children. Whenever we see patients, it's always parents. There is no child that comes to a visit on his or her own, except maybe an occasional one after 16, 17. And so I'm taking care of the patient and the parents. It's a big time involvement of parents in their care for sure. I see all different types of patients within the domain of pediatric neurology. I do general pediatric neurology in the sense of headache, ADHD, behavior problems, seizures, tics. And some in the middle of all this, there will be some patients which are out of the ordinary with much more complicated or exotic diagnosis, which also I will take care of in the initial steps. But once a diagnosis has been made, usually I'll plug them to the right clinic so they get the best care. A new patient usually is a 1 hour visit. Sometimes it spills over 1 hour, the more complicated it is. From start to end, the purpose is to get a good history and then do your examination and then summarize and come up with what is the most likely diagnosis and what is my plan. When I get feedbacks from patients, I think my pluses are thoroughness and then promptness in responding to phone calls or compassion. So overall, if you ask me in one sentence, what is your approach, I will say I always tend to think, what if this were my child? So that helps me in guiding decisions or handling patients.